Hey, this is Dr. Murray from Murray Natural Health here in Hastings, Nebraska, doing a short video for you here today. And this one is on hypertension and cardiovascular disease. It is so important for us to realize that around 80%, this is studies that are in the American Heart Association in their journal, say around 80% of all cardiovascular disease is preventable. And other studies showing that around 2/3 of all hypertension is actually reversible. I mean, that's pretty cool. I mean, that should actually preach, you would think. So we're offering this month a free heart health screening where we're doing the EKG, we're doing vitals, we're also looking at ankle brachial indexes, a free heart health screening for this month because this is Heart Health Month, right? So, but let me talk to you just a little bit about hypertension. So pressure within your arteries is predicated on two basic areas. You have cardiac output and peripheral resistance. And this is a really pathetic looking heart here. So you have peripheral resistance and cardiac output actually are the two variables that affect how much pressure is actually inside your arteries. Peripheral resistance meaning how much pressure on the arteries and also your kidneys themselves, they affect that peripheral resistance. The stiffness in your arteries and the muscles, the tissue itself, the tunica intima and adventitia and all the different layers of the arteries, they affect the stiffness of the walls of the arteries, and that affects how much pressure is in there, but also how much cardiac output, how much the heart is actually pushing will actually affect the blood pressure within the arteries as well. Why is that a big issue? Because if you have a lot of pressure within the arteries, then the arteries, of course, can become injured, right? And that's kind of the start of plaquing that can occur within arteries. So blood pressure is a very important factor that can affect cardiovascular disease. And again, around 2/3 of hypertension cases can be actually reversed. So what are the things that actually promote high blood pressure? Well, first you can start to look at, of course, glucose, blood sugar. When you have too high a sugar in your body, that is pro-inflammatory. So maintaining good, proper glucose levels. Sometimes we'll have patients do intermittent fasting, and we give, of course, prescriptions for that because that's important as well. Obviously, smoking, that can certainly increase blood pressure. Alcohol can as well. So what we put in our bodies most certainly can have an impact on how much inflammation, how much pressure is within our arteries there. Besides that, if you look at other factors that affect blood pressure within our body, some of those things maybe we want to make sure we're getting enough of. B12, vitamin D is another one. There are multiple studies on vitamin D as well as B12. B12 also affects your homocysteine levels. Some people have what they call an MTHFR, a methylation problem. They have a genetic problem with how their body methylates, and so they're not utilizing B12 properly, and so they have a lot of homocysteine that's floating around within their blood vascular systems, and it is injuring the arteries, but it's also causing the arteries to contract more. And so even the American Heart Association, you look on their website and they talk about the association between hyperhomocysteinemia and also low B12 levels. And so this is an obvious one that you can test with patients. Some patients might need a B12 injection, but still it's not to test is to guess and to test is to know. You can test for these things. Vitamin D, of course, another thing you can test. There's multiple studies related to vitamin D and cardiovascular disease, but also hypertension as well. Your omega-3 fatty acids. Your omega-3 fatty acids, the good fats, if you may. None of these essential fatty acids are good or bad per se. They're part of your body. They're essential. You have to have them. Well, some people are not eating enough fish, or they're eating way too many grains. And so their omega-6s may be actually high. Their omega-6 oils may be actually high, which is actually can increase inflammatory cascades within the body, increase blood pressure, and other people have actually too low the omega-3s, and that is contributing towards blood pressure problems as well. There's multiple nutrients as well as potassium and different minerals that might also play a role in this. Salt is one thing. If you just look up in here and kind of put that on the negative side, and that it is and it's not, you do need salt. But remember this, these two things right here, Why do we add salt? Why do we add glucose or sugar to our foods? Not because there's any nutritional value whatsoever, really. We're adding them to our foods because we want them, because we like the taste. It is true that some people will actually need some potassium, need some salt, need some type of an electrolyte mineral there because they're low. But most people are taking in too much. And that's why the dietary approaches to stop hypertension, this is a well-known study showing that actually reducing salt intake for many patients will actually reduce their blood pressure. And some people, in almost half the patients, their blood pressure will reduce if they reduce their salt intake because they're getting in too much. And some people have a sensitivity to salt as they age, and their kidneys don't deal as well with the high amount of sodium. And so that's an easy one, at least, to try out, is the DASH, the dietary approaches to stop hypertension diet, which is reducing some of that salt intake. On the other side of that, you can also drink too much water, because some people are even more of a water drinking zealot than I am, and they're drinking dangerous amounts. So you do have to check out people, make sure that the potassium and sodium levels and those things aren't too low, because they're actually urinating out all their water, and some of the minerals are going with them. So some people actually are low in potassium or sodium. But in general, the salt, reducing your salt intake is obviously a good thing for most people to give that a try and see how that affects them, because it also can affect allergy kind of presentations as well. Also hormones down here. Doesn't it make sense that a lot of these issues with hypertension, cardiovascular disease, they're happening as a person ages? What happens as we age? Our metabolism changes. And one of those things that can change, of course, are your sex hormones. Your metabolism is predicated on your thyroid, your sex hormones, and also your muscles all affect your metabolism. Well, your sex hormones most certainly affect this. And so testing this, if we have concerns over those things, that somebody's having hypertension, it's uncontrolled, they're not able to get it down, it's time to start looking for root causes of problems. And one other factor, I'm going to ensure one other thing here, which is something, if you're not already doing it, because a lot of people are doing some omega-3s, you may not be doing enough. That's why you can actually test for it. And I'll tell you what, very few people are in optimal ranges on omega-3s. Very few people are in optimal ranges on their vitamin D. Find that all the time. Some people also are low in nitric oxide. And nitric oxide is something that your blood vessels use all the time. Your heart uses it, your kidney uses it, your arteries use it. It helps to heal your arteries. It helps to heal these areas right here. Nitric oxide. You make nitric oxide from L-arginine. You make that from even beetroot. That's kind of, if you ever heard of the one of the supplements back in the day was Super Beets, because there's some neat studies on beetroot and its effect on healing arteries and keeping blood pressure levels down. So we're constantly, that's an easy one to recommend, although we also recommend the nitric oxide support in a form that also has beetroot, but also has L-sertraline, because some people don't metabolize the beetroot properly. So there are some things to take, including beetroot and L-sertraline, that can support nitric oxide levels and help to reduce pressure within the arteries too. One thing you always need to do is you always want to make sure that your numbers are normal or okay. Your blood pressure will come up as you age a little bit, and coming up a little bit is fine. Coming a lot of it is not fine. Not to test is to guess, but to test is to know. Looking at your blood pressure is important. It is an important factor affecting cardiovascular disease, and the good thing is that a lot of people can have improvement of their cardiovascular presentation, because we do all cardiac-related testing. We're going to talk about that later with different lipoprotein testing. But you can also look at your nutrient testing and support your body so it can heal, repair, and self-regulate. So take part in our heart health screening, which is free for this month. Give our office a call, and we can certainly help you out with that. Murray Natural Integrated Health, setting the standard in natural health care. Have a blessed day.